Hi, everyone. Welcome back to another fantastic episode on the Unleashing Potentials podcast. My name is Bernadette Desir, and I'm your host. Joining me today, all the way from sunny Texas. It's in Texas, right?
Austin, uh-huh.
Austin, Texas is
Hmm.
Kathie. Kathie, how are you?
I'm good. How are you doing, Bernadette?
I'm doing great. I am so honored and appreciate you coming on the podcast today.
No problem. Thanks for having me.
You're welcome. So, Kathie, why don't you start by telling us who you are and what you do?
Well, my name's Kathie Bolles, and I am a psychiatric mental health nurse practitioner in Austin. Um, I've been a nurse since I was born, I think. Um, Actually, I hate to say it, but 42 years. Uh, and right now, I have a practice called Mynd Works Psychiatry, and I see adolescents and adults
Mhm.
that are struggling with mental health issues. Um, and we do a couple things. We provide medication management when that's needed, which is most of the time. We offer psychotherapy, and we're just adding what's called functional medicine nutrition. And so it's kind of an integrative approach because we believe we like it to be more of a holistic sort of thing.
Yeah, I love that. Thank you for sharing. I think the work you are doing is so needed in this world, especially for youth. I'm all about mental health, so I'm excited. Can you tell us what got you in the line of work that you're doing? I know you've been doing it for a long time. Did
Right.
something happen for you to choose that path?
To be honest, I was always wanting to help people. So um, that was always going to be the direction. It was just a matter of where I was going to go. And my parents said, be a nurse, you'll always have a job. So, so I did, and I'm really glad I did. Like I said, it's been 42 years. Now I did something else once I was into that role. I went back and got a master's in counseling psychology. So I actually had a private psychotherapy practice for a while before I got my master's in nursing so that I could actually prescribe.
Mm.
So yeah, just I love people and I like helping people, and it's very rewarding watching them get better.
Thank you for sharing. Why do you think it's important for us to keep talking about mental health?
Why do I think it's important?
Hmm.
Because it's critical in terms of getting well and staying well, um, as an individual, as a community, as a country, as a world. Uh, Mental health has had stigma around it. I think that's lessening, particularly since COVID.
Hmm.
And but you got to talk, you got to process, you've got to share what's going on with you, and um, let somebody help you.
Yeah, 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 definitely. I agree with you. There's a lot of stigma. And it took me a very, very long time to be able to accept what I'm diagnosed with and to be able to surrender to share to help people. Because I'm diagnosed with schizophrenia. I am not schizophrenia. It's an illness and
Correct.
PTSD, anxiety, and depression. And I know the schizophrenia part, it terrifies people because of what the media is putting out there. Obviously, there are people who need more help than others, but there's a lot of
Yes.
shame and stigma around it. Yeah, how can people come forward and do it afraid and still get help?
I'm sorry.
How can people who feel ashamed and people who are embarrassed of what they have, how can they find the courage to step forward to ask for help?
It's a really big question. I had a patient yesterday who has been severely depressed and having suicidal thoughts for 2 years. And he's just now coming forward and saying, okay, I need help. Um, it's different for everybody. But I think knowing it's okay not to be okay,
Mhm.
and maybe going to your family at first, somebody close to you, a close friend. Sometimes family isn't the right person, but um, talking to someone about what's going on with you, it will open things up.
Mhm.
And but yeah, I think giving yourself permission to get the help you need. Some people think that if they go for help, that means they're weak. Um, it really, I tell them it's actually the opposite. It takes a lot of courage and a lot of strength to go get help versus the other way around. So maybe recognizing that and just taking the step.
Yeah, yeah, definitely. I agree. Thank you for sharing. What are some warning signs that someone is struggling with mental health? Because at times it doesn't happen all of a sudden. I think it's a gradual process and it gets worse and worse and worse. How can people like you and doctors caught it early on to treat it?
How can the provider catch it on either early on?
Yeah, yeah. How can they catch it on early?
Well, my what I do is a specialty. So people that come to me are already struggling. So it's kind of already been identified to some degree. My role is to determine what exactly are we dealing with. Um, is it just anxiety? Is it just depression? Is it bipolar? Is it schizophrenia? Um, because being able to get the right diagnosis is critical to get the right treatment. I mean, I don't know if we haven't talked about this yet, but I too have struggled with mental health problems. Um, I had my first depressive episode like at 30.
Mhm.
And so I have walked the journey that all my patients walk. Uh, and my journey was particularly difficult. I
Mhm.
tried every medicine there is. I tried transcranial magnetic stimulation, neurofeedback, ketamine. I even had brain surgery.
Mm.
Um, I was in a study, but I don't quit, and so I always believe there's something that's going to help, and that's one of the messages I like to give my patients as well is don't give up. You can feel better, and yeah,
Mm.
so you just
Yeah.
got to keep going.
Yeah, yeah, I agree. At the time, how did you find the courage to seek for help?
How did I find the courage? I don't know if it was courage. I think I was desperate. I was just so
Yeah.
depressed, you know. Um, yeah, I tend to be a pretty open book. So it's not hard for me to go like some people. It's very difficult. It's not hard for me to go to the doctor or the psych provider and tell them what's going on with me. Um, and then of course now that I do that, I in that role, I probably drive them crazy, but um, I just totally lost my train of thought.
That's all right. I did too. Oh well, carry on.
There we go.
Yeah, yeah, it's all good. What are some coping strategies that people can do to maintain their wellness when it comes to mental health?
Well, self-care, overall, which looks different for different people, but that definitely is going to include nutrition, exercise. I mean, it sounds kind of um, routine, but it really is important. Um, Exercise helps some people more than other people, but it definitely changes things in the brain. Um, and minimizing stress Stress really triggers things, particularly, I mean, just in general, but particularly with bipolar patients. Stress can trigger mania, it can trigger depression, that kind of thing. So stress, minimizing stress is an important one. What else? Um, some people get a lot of benefit from like meditation, mindfulness, that kind of thing.
Mm-hmm.
And then of course psychotherapy. Psychotherapy is critical. If you're on a medicine and you're not stable yet, you should be in psychotherapy. And that one is um some people are very open to it and other people not so much.
Mm-hmm. Can you tell us what is psychotherapy for those who don't know what it means?
Well, psychotherapy, there are there's a psychiatrist, which that's a doctor, an MD who prescribes medicines. And there's psychiatric mental health nurse practitioner who I am, which is a master's prepared nurse who also prescribes and can do therapy. Um, and I always say that doctors are trained to see the disorder first and the patient second.
Mm.
And under the nursing model, we're trained to see the person first and the disorder second. And so, not to say anything bad about psychiatrists, because a lot of them are very excellent, but
Mhm.
I think because of that, nurse practitioners tend to be very comprehensive and um,
Mhm.
I think have a better or can have a better bedside manner.
Mhm.
And then you have your psychotherapy, well, PhDs, doctorate level psychologists.
Mhm.
They tend to do a lot of testing, but can also do actual psychotherapy. And psychotherapy itself is a conversation. Um, there's a long, long list of types of psychotherapy, but um, it really depends on what you're struggling with and the therapist. They're trained in different things. There's something called EMDR, which is eye movement desensitization reprocessing, which is a trauma approach. It has to do with eye movement.
Mhm.
CBT, cognitive behavioral therapy, which is your thoughts and your behaviors and uncovering the disempowering ones. So there's a long list, but it's essentially typically, well, now it's face to face or virtual um, conversation where you're looking at yourself and you're looking at your life to see what's working, what's not working, and how to be your best self.
Yeah, yeah. I've done CBT many times. Obviously, when I was really, really sick, I didn't find or understand the point of it.
Right.
I just wanted to be comforted for it to be gone. Obviously, there's different levels, right? Let's talk about very, very sick patients. Patients that are suffering to the point of not being able to make decisions for themselves.
Hmm.
How and where does the healthcare teams come in to
Hmm.
help that person?
Well, depending on the situation, they may need to be hospitalized
Yeah.
because when you get to a certain point, nothing's working, you're suicidal, um, and you just don't feel like you can take another step, you need to be in a safe place. And so that becomes a different healthcare team, the inpatient healthcare team, which includes the doctors, the nurses, the therapists. Um, but it's typically a relatively short stay. It could be 3 days, 5 days, 7 days. Used to be a lot longer, but now with insurance companies, they tend to
Hmm.
minimize that. Um, but it also depends on how well the patient's doing.
Yeah. Yeah.
And then when they leave, they like the patient to step down to what's called partial hospital program, which is um, most of the day, 4 days a week. And then once they're stepped down from that, they go to intensive outpatient, which is 3 hours a day, 4 days a week. Um, so it's just, and then back to therapy. So it's a support structure to keep you um, continuing to do better.
Yeah, yeah, yeah. I know it's different where you are in the States than here.
Yeah.
When it's really, really bad, I've had situations where it was bad for me. They sent police for welfare checkup. I'm not
Oh,
sure
yeah.
that's something they do there. And then if it's really bad while they're there, legally they're allowed to
To
forcefully
commit.
take the person to the hospital or psychiatric unit.
Yes.
Is it the same
Yes.
there or?
Yes. I left that out. I was thinking of if they were in my office, but if they're at
Oh, okay.
home, um, you send, we have mental health deputies,
Oh, okay.
and we're getting those trained in more and more places because, as you know from the media, a lot of police officers don't know how to deal with mental health
Mm-hmm.
people,
Mm-hmm.
and they don't understand what's going on, and lots of bad things happen. So we
Yeah.
have mental health deputies in Austin, and so when I tell my patients, like, if they need to, if the mother needs to call someone, ask for a mental health deputy. Mental health deputies come out and do an assessment, um, and make a determination if the person is safe or not. And like you said, they can commit them. We also have a mobile crisis team, which is part of the Travis County public mental health system, and they come out as well. So there's a number of resources to support those folks.
Mm-hmm. Yeah, that's good. And also here it's for 30 days.
Is that right?
Yeah, 30
You know what it
days.
is here? 48 hours.
Yeah, it's
48
very different
hours.
here. No, no. If someone's very, very sick, they forcefully take them in and they sign them in for 30 days.
So you
Like,
probably have a
yeah,
lot less mental health crimes
we do.
than
We have less.
we
Yeah.
do.
Yeah, I'm seeing way more in the States. I don't watch the news, but I've seen really bad ones where people just get out and slaughter people.
Yeah,
And that
exactly.
makes it look really bad for me, you guys.
Yeah, me too. Me too.
Because I'm on healthy drugs. I'm taking my meds. I'm stable. I'm not hallucinating. But when I see stuff like that in the news, I'm like, oh crap.
Yeah, yeah. I will
Where do I
always
go
take
from
my
there?
meds.
Yeah.
I will always take my meds. I don't do well without them. And I mean, I share with most of my patients, what I've been through because I want them to know that I know,
Oh,
and
yeah.
when they have a side effect, I typically have had that side effect and I know that it's not tolerable.
Mm,
So, I will tell when appropriate, most patients that what I've been through. And I think they appreciate it. They usually thank me for telling them. I think it
yeah.
makes them feel better. And they get that I get it. Um,
Hmm.
so yeah, and so I tell them I will always take my meds. I do not do well when I don't take my meds. And I think of them as a vitamin.
Hmm. Hmm. And I honor and appreciate that you're opening up to them when it's the right time to do so. That's why I'm doing what I'm doing because
Yeah,
when you know what someone has been through, they're more willing to accept help and to be heard.
absolutely. Absolutely. And
Yeah.
so, yeah, and I think I forgot to tell you something. I'll come back to it. But,
Hmm.
my the way I do what I do, I didn't mention that I use genetic testing. And so genetic testing is an oral swab, and we look at gene drug interaction, metabolism, helps with dosing. It looks at side effects and sometimes efficacy. And so it helps guide prescribing. And so it's more precision because psychiatry is essentially a trial and error process. You can't draw blood, you can't do an x-ray and say, this is what you have and this is what you need. It's trial and error. So we do a comprehensive, as you know this, we do a comprehensive eval. We look at family history. We look at what meds you've been on. Um, we look at everything we can, and then we make a decision. Okay, this is what I think we're dealing with, and this is the medicine I want to start you on. Um, thank goodness, sometimes it works. A lot of times it works, and a lot of times it doesn't. And so then you have to try the next medicine, and then you have to try the next medicine, and then you have to try the next medicine. And people suffer. And so my commitment in doing what I do the way I do it is to end the suffering. I mean, I suffered,
Mm-hmm.
uh, and I'm not 100%. I mean, I still struggle with a little bit, but
Mm-hmm.
um, I want to end the suffering and make this available to as many people as possible.
Mm. Yeah, I love that. Thank you for sharing. Yeah.
Mhm.
I was like a lab rat in the hospital. That's the best way I can put it. It's true. I don't know what other words to use.
Yeah.
And I've tried so many different medications. At one point, they took me off all of my meds. I didn't know if I was dead, if I was alive, because
Oh my gosh.
I get outer body experiences. I still have it as I'm talking to you right now. I'm trying to ground myself. They completely took me off. And
Wow.
I had zero say of what they were doing because I was mentally ill.
Why
What I
did they
had
do
to
that?
say,
Did they tell
well,
you what?
they were trying different medications to see what works. And it took what felt like years to find something that works.
Mm-hmm.
It's
Mm-hmm.
awful going through that process, and it
Mm-hmm.
can be traumatizing for the patient.
Right.
I was
Absolutely.
traumatized.
Absolutely. So that's what we're trying to do with Mind Works is minimize the trial and error.
Mhm.
Um, you know, it's
Yeah,
it's a difficult process otherwise.
it is. Yeah, yeah. Let's talk about sleep, nutrition. How do these play? What are their role when it comes to mental health? I'm trying. I'm struggling, people. That's okay.
You're what?
I'm struggling. Sometimes I have thoughts and I'm just trying to get them out of my mouth so I can ask the proper
Oh,
questions.
you're fine. You're fine. Um, well, sleep is critical for everybody, just for overall health, heart health, brain health, everything, but definitely mental health. Um, it's um, it's critical. I mean, what can I
Mhm,
say?
mhm,
Um, Nutrition, that's one of the things we're adding. Um, my licensed dietitian is named Gina. I'm very excited about having her. Um, she she's the expert on that one. But I think it's goes to easy to say that what you put in your mouth makes a big difference. I mean, I don't
mhm.
know if you've watched the documentary "You Are What You Eat." Have you
I'm
watched that?
scared to watch it.
Just go to watch it. Yeah. Um,
Yeah, I'm in
it's
denial.
yeah. Well, most of they talk about the outside of the grocery store. Have you heard that? The outer side. I don't know if Canada's like that. And then everything in the middle is processed.
Oh,
And
yeah.
it really did transform how I see food.
Mm.
Um, Now when I look at a Big Mac, I don't see food.
Oh, yeah,
I see junk.
yeah.
And so, you know, vegetables, fruits,
Mm,
healthy protein, all the stuff on the outer dairy. Dairy's okay. Some people say no dairy. Um, Depends on if you can tolerate it. Um,
mm,
is healthy nutrition, and it's just as important as the exercise and the sleep.
mm. Yeah, 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 I agree. Yeah. Yeah, I do struggle to eat fast food. I I struggle. I just can't do it. I grew up eating fresh fruits, fresh vegetables. We grow everything in a tropical place. And then here you come, there's canned and processed stuff.
Mm-hmm.
Yeah, yeah. It's tough. I know here there's dietitians of different categories that can help people. Is that something that is where you are that can help people understand what to eat and the impact of what they're eating?
Well, there's licensed nutritionists,
Mm.
and then there's licensed dietitians. And you know what? To be quite honest, I'm not sure the difference.
I
There
don't
is a
know either.
difference.
Oh,
There is
there
a
is.
difference, but
Yeah.
I don't know what it is.
Mm.
Um, Obviously, they're both experts in that realm,
Yeah.
but the subtle difference, I'm not sure.
I guess food. I don't
Right,
understand.
right,
Yeah, yeah, yeah,
for sure.
yeah. Um, the next question I'm gonna ask, I've had to live it every day. Um,
Hmm.
how can people set boundaries to protect their mental health, either from others, from family members, or themselves?
Hmm. It's a really good question. I'm gonna have to think about it in a minute.
Mm-hmm.
Um, how can people set boundaries? We know boundary setting is necessary just for
Mm-hmm.
every aspect of your life.
Yeah.
But I would say mental health is probably one of the even more important ones. Um, and it's all about communication
Mm-hmm.
and being willing and able to say what's so for you. This doesn't work for me. Please, I need you. This is what I need from you, kind of thing. Um, and it's tricky because how well that goes is dependent on how well the other person can communicate.
Mm.
You know
Yeah,
what I mean?
yeah.
So, if you obviously most family members love each other and they want the best for the other person. So you can only hope that they're going to listen to you. Um,
Yeah.
but it's going to take courage
Mm-hmm. Mm-hmm. Yeah.
to
Yeah.
have those conversations.
Yeah.
And I have one patient right now, and she has a just a very volatile relationship, particularly with her father. And so we're working on her setting boundaries with him. And she wants to, and she knows she needs to, but she's really scared to.
Mm.
Um, but she's going to. Um, and I think it's going to really help her depression.
Yeah.
So when you don't do it, it's definitely going to negatively impact things.
Mm-hmm. Yeah. Yeah, I
Do you know what I
agree.
mean?
Yeah, absolutely. Um, Boundaries, it's such a easy, hard, and complex word, and it's very difficult to put it in action and to keep it in action.
Mhm.
Um, yeah. Obviously,
It's
yeah.
often not a one-time thing.
Yes, yes,
You have to
absolutely.
you have to
Yeah,
do it, and then you might have to say it again. You might have to say it again.
yeah, yeah. And obviously, life will never be the same before any diagnosis, right? For me, I've had people fall away. Why? Because it's overstimulating to go downtown. And I don't like crowds. Since I got diagnosed, I had to learn that's okay. And I had to
Yes,
let people leave because I no longer can fulfill their expectations of me.
right,
So
right.
that's a boundary I had to set. And it's hard to do that. Let's tie boundaries to advocacy because I think they go hand in hand.
My favorite topic.
Take it away.
Take it away. Well, you I tell my patients you have to advocate for yourself. I don't care what doctor's office you're in.
Yeah.
And I'm specifically referring to healthcare. Um, too many people go in and just listen to whatever the doctor says and does whatever the doctor says to do and don't take care of themselves. So, I'll tell them write down your symptoms and your questions, um, prepare,
Hmm.
And, to remember that he's working for you, or he or she is working for you. It's not the other way around. And if you're not satisfied, you can always get another provider. But you've got to take a stand for yourself and say what you need to say, ask what you need to ask, because
Mhm.
that's going to empower you and get you a better outcome.
Yeah, yeah, yeah. And I think once someone has suffered so much, eventually they're gonna want to put an end to their suffering. And that
Mhm.
comes with them not being able to properly communicate. It's not because they don't want to most of the time. I think it's fear. All right. It's fear. It depends on which culture, how you were brought up. For me, respect people that are older than you and respect life. We just respect
Right.
people. So I did find it hard to disagree um, with someone who has experiences that I don't have.
Yeah.
I'm in medical
Yeah.
education, right? So it did take me a while, but I'm able to do it now, as you can
Well, it's
see.
kind of like
Yeah.
there's this hierarchy, and this is the doctor and this is the patient, and it really needs to be like this
Yes.
collaboration.
Yeah.
I'm very collaborative with my patients, and I tell them that up front. We're going to work together. Um, I am not going to expect you to take something that makes you feel worse. Um, yeah, we're going to figure this out together, and it really puts them at ease.
Hmm. Yeah, yeah, absolutely. Let's talk about the impact of mental health when it comes to different communities. All right. LGBTQ, Black, Latino, whatever category people put people in those days. I lost
Hmm.
track.
I lost track of those letters.
Yeah, all the
Yeah,
labels and letters. Tell us based on your experience and practice. Are there any improvements? Is it getting better? Is everyone being heard?
really good question. I don't know if I know the answer to that question.
Mm,
I have numerous gay uh, patients that I adore, um, and they're getting good care with me, but I'm not sure I really know as an overall community type
mm-hmm.
um, answer to that.
Yeah, it's a very big one too. I don't even know
Yeah,
the answer to it.
yeah.
It's a big one. Yeah, yeah.
Well, I know there are specialists out there that specialize in that community. So, I mean, that's a step in the right direction.
Yeah. Let's talk about some of the challenges men and women face when it comes to mental health. Us women, we're chatty, all right? If we're feeling something, we're gonna let you know how we feel. But sometimes for men or boys, it's very hard to express themselves, to be vulnerable, and to get help. What
Absolutely.
what are your thoughts?
Oh, I mean, I just agree with you. I think a woman is more likely to come in when she's not doing well and ask for the help she needs, where a man, he's going to put it off longer. Of course, it's individualized, but as a general rule, I would agree that they tend to wait it out, sometimes too long, unfortunately. But I think that is a clear difference.
Yeah, yeah, that's true. Yeah. In the workplace, do you think mental health is being treated and taken seriously?
You have hard questions. In the workplace,
Sorry.
do I think mental health is being treated properly? Is that what you said?
Yeah, yeah, yeah.
I think more so than it was.
Mm,
I just had a friend she's a manager, and she told me that her employee just told her she was doing ketamine once a week. So I think people are a little less afraid of sharing that they're struggling. Um, with that said, I always tell my patients, you need to be careful what you share, depending on what's going on at work. If things are not going well, you might not be the right time. It depends.
Hmm. Hmm.
But I think it's uh being more and more accepted.
Yeah, I think
And
so too. Yeah, yeah. And it's just advocacy to continue to speak up and to hear people out. Because,
yeah.
yeah, I mean, after COVID, it shook the whole world. It's so hard to find job, to keep job. Lord have mercy if you have mental health. It means you're not capable to meet their standards. In some
Hmm.
companies, not all companies, I'm not speaking for everybody there, but it's hard. That's why I work for myself. It's really hard. They don't always give people like us a chance to
Yeah.
explore, to show our gifts.
Well, if they know ahead of time, you're right. You're
Mm-hmm.
right.
Mm-hmm.
And I don't think legally they can, but
Oh, they
if they
do.
fi- if they find out somehow they will. Yeah.
Yeah. Yeah, they do. They do. We have nice stuff here in Canada. Nice, nice, nice. We have nice racism. Nice way of sweeping things under the rug, pretending they don't
Oh,
exist. Right? It's like it's the elephant in the room that everybody sees but refuses to talk about.
gotcha. Gotcha.
Yeah,
Gotcha.
yeah, yeah.
Well, I see here, I think it's illegal, so I didn't think it was really happening that much, but
Yeah.
um, I don't know.
Mm-hmm. Mm-hmm. Yeah. Um, Talk to us about faith and spirituality, which also I think ties with self-care and meditation. In your opinion, how important are those for people? Because faith, it gives us something to look forward to be hopeful for.
Hmm. Yeah, I think they're both critical. People, this is how I distinguish faith and spirituality. People that have a particular faith are choosing a particular religion, whereas people that are spiritual, it's more spiritual, um, and not necessarily religious, but both. Either way, um, are important and gives gives you something to hold on to. Um, and I had a patient who wasn't didn't know what she believed, and she was really really struggling. And I'm a Christian, so you know,
Hmm.
nothing against anybody else, but and she was a Christian. So I asked her if she'd ever read the book Mere Christianity. Very simple C.S. Lewis read. And he was an atheist, and then he went out to disprove Christianity and converted. So he wrote this book. So she said, no, I haven't. So I actually sent it to her. She
Mm,
doesn't have any money.
yeah.
And so I just sent it to her. So she started reading it. And the next time we talked, I swear, it was like 3 weeks later, she said, I said, well, how's it going? Are you reading it? She goes, oh, yeah. She goes, I know why I'm here now.
Mm,
I know what his purpose is for me. I was just like blown away. She was
wow.
just so ready and open
Mhm.
to faith that the time was right. Now, I don't bring that up with a lot of people, but because of the situation with her, I went ahead and did that. But I would like to bring it up with everybody.
Mhm.
Now, in my initial eval, I do ask that question. Are you spiritually active? And if they say no, it kind of ends there. But it's kind of a fine line of whether where to go with that. How far can you go, and do you bring it up again or not? You know what I'm saying?
Oh yeah, it's a very, very sensitive, touchy, popular, not so popular topic to talk about. There's so many
Yeah.
ways. That's why for me, I'm like, whatever you believe in, great. As long as you're not
Right.
hurting people, I don't care what people look like, what they believe in, what language
Right.
they talk, because I think we're all
Right.
one, we're all connected, and we're all seeking, searching for something, either
Exactly.
inside of us or outside of us. And how we
Exactly. And
find it,
who am
yeah.
I to judge?
Oh yeah,
You
yeah,
know.
yeah, yeah,
So
yeah, definitely. Yeah. Are we running out of time?
Oh, yes, we are. We definitely are.
All right, you guys, come back for part two. Yeah, what an amazing conversation this has been. Is there anything that we didn't get to talk about that you'd like to share with us?
Let me think. Um, just that, if you want to find out more about us, go to our website. It's Mind Works Psych or mindworkspsychiatry.com. Um, and you can what I do is I meet with people for an hour or 30 minutes to 45 minutes complimentary to get a sense of where they're at, see if I can help or not. I like to do that. I think it makes more sense than having somebody have to commit to something before they even know
Mm,
what is what. You know what I'm saying?
mm,
But, we people that we see are the people that are typically been looking and searching for something different,
yeah, yeah.
for a different approach, a different solution. Um, so that's what we're up to. And like I said, I want to end the suffering.
Yes, yes. Me too. I'll team up and we
I
can
get
do it
that.
together. Yeah, yeah, absolutely. Yeah. I have one last question for you, which I ask every guest.
Uh-oh.
What is the meaning of life for you?
Oh my goodness. That is no small question, Bernadette.
I
Good
tried.
golly. Well, for me, the meaning of life for me is service.
Mm, yeah.
Like I'm here to serve. That's what life's about. And I heard the other day they were talking about success and what most people think of as success, which of course you think money and this and that and the other. And the answer was success is determined by how you loved,
Mm,
which I really, really like.
yeah, I like that too. Yeah, yeah,
Hmm.
yeah. Thank you. Well,
Hmm.
Kathie, thank you so much for your time. Thank you for serving, for healing, and restoring hope for those who need it the most. And thank you
You're
for
welcome.
coming on the podcast. This was
No
so much
problem.
fun. Thank you.
Yeah.